Utah researchers tonight are sharing growing evidence of a clear link between heart disease and COVID-19.
That conclusion comes after several studies. As news specialist Jed Bull shows us, scientists with Intermountain say that raises new concerns for COVID-19 patients of all ages.
We've known since COVID-19 emerged that it can do serious damage to patients' lungs. Now there's growing evidence that COVID-19 can also damage people's hearts, raising concerns for people with the virus of any age.
The virus can infect the heart itself, and it can also stimulate clotting.
Dr. Kirk Knowlton, the director of cardiovascular research at Intermountain Healthcare, examined more than 100 published studies related to COVID-19 and its effects on the heart. He found many COVID-19 patients also suffer significant cardiovascular damage that might continue after they have otherwise recovered.
When they had heart disease, their prognosis was much worse. They had a many-fold higher rate of being intubated or even of dying from COVID-19 if they had heart disease.
If there was no evidence of heart disease, they had a better chance of surviving.
The virus, the inflammation, clotting, something is causing heart damage, even during the acute illness.
Studies showed damage caused by the virus itself, from inflammation triggered by the immune system's response to the virus, or from increased clotting in heart vessels. One study showed structural damage to the heart in more than half of COVID-19 patients examined.
I'd hate to think that half of everyone that has COVID-19 is going to end up with some myocardial damage. In the long run, we don't know a year from now what that will look like, whether they'll perfectly recover or not.
There's also evidence that heart damage may be long-lasting in some cases. Leaders from the NCAA's Pac-12 conference cited COVID-related heart inflammation when postponing fall sports. That's after at least 10 football players developed heart inflammation after being diagnosed with COVID. Knowlton says this raises new concerns for young people who have not necessarily been as heavily impacted by COVID-19. If COVID-19 is creating long-term damage in hearts, everyone should be concerned.
It gives us cause for pause to think about the importance of preventing the disease.
Right now, researchers just don't know how often the heart damage will occur and whether it can impact patients with even mild symptoms. That research is now published in the Journal of Molecular and Cellular Cardiology. In Murray, I'm Jed Bull for KSL 5 News.
Thank you, Jed.